all know accidents happen as a child, and a potty dance just isn't enough from keeping it in. As we get older, we know how to handle the unwanted pressure on our bladder, until we can make it to the restroom, of course. So this is a body system that most people don't like to say or smell, but it actually does the body some justice. This system is the urinary system is to filter toxins out of the blood. The main organs of the urinary system are the kidneys, the ureters, the bladder, and the urethra. Did you know that at any given moment, 20% of your total blood volume could be at your kidney at any given moment? So the kidneys are the main location of filtration. First, blood flows through large renal arteries and into the kidney. The outer portion of the kidney is the cortex, the inner is the medulla. The medulla is then made up of millions of nephrons. Nephrons are then divided into the Bowman's capsule and the glomerulus. The glomerulus is a network of blood capillaries. The first part of the nephron is the proximal convoluted tubule. Then blood flows to the loop of Henle. After the loop of Henle, we have what is left over is urea. Urea is then formed into urine. Then, after it leaves the kidney, urine flows through the ureters into the bladder. Bladder is then held until you have to pee, and your pee then leaves out through the urethra, so you can finally pee.
Now that we're all done talking about the scientific background of the kidneys, let's talk about how we can keep them healthy. It really isn't so hard. All you must do is make small lifestyle changes to make sure that they continue to function properly. Step 1. Drink at least 10 glasses of water to flush out toxins. Step 2. Exercise regularly for at least 30 minutes. Step 3. Maintain a healthy body weight. And Step 4. Prepare foods with low salt and sodium. These steps will contribute in making it easier for your kidneys to do their job and filter out all the toxins from your blood. You can also prevent any kidney diseases by avoiding to smoke and drink. Lastly, you should go to your doctors for annual regular checkups to see how your kidneys are doing. All you need is blood and urine samples.
There are many things that can cause the system to become unhealthy. These things include a sedentary lifestyle, acidic foods, and dehydration. A sedentary lifestyle can lead to not only depression but chronic kidney disease. Acidic foods are those that are low in pH, they are high in sugar, and they are also processed foods. These foods affect your urinary system's ability to kill bacteria. Dehydration is also very bad for your urinary system because water is to the body as oil is to a car. It lubricates everything, so all processes can run. Coffee is one of those things that is a very, very powerful dehydrator. Water also can flush out toxins, so if we don't have water, we are at risk of having an
Another
infection.
common infection associated with the urinary system is pyelonephritis. So basically, pyelonephritis is the inflammation of one or both kidneys due to a bacteria or virus infection. The specific disease affects the kidneys and causes inflammation in one or both kidneys and in the connective tissue. So symptoms of this disease are vomiting, fever, chills, pain in the lower ribs near the abdomen on the side, and also growing pains. Also, painful urination and urges to urinate will also occur. But thankfully, this all can be treated with antibiotics, painkillers, and fluids. Women are more at risk of getting this disease and are at a higher risk once pregnant. Men typically in their 50s often acquire pyelonephritis once their prostate enlarges. And also children with weak immune systems are at risk. Other ways men and women can get pyelonephritis if they had past or present diabetes, kidney stones, a bladder tumor, untreated urinary tract infection, and an obstruction of the urinary tract due to abnormal development. Doctors diagnose this disease by using a kidney ultrasound or a urine test. So how does this affect you in the long run in your life? Well, if treated properly, most people don't have any complications, but some cases can lead to permanent kidney scarring, chronic kidney disease, high blood pressure, and kidney failure.
Like McKenna said, infections are horrible, and you should do what you can to prevent what you can. Unfortunately, however, you can't prevent all diseases in the urinary system, and some of them happen for weird reasons. For example, let's say your kidneys can't secrete protein. Have you ever wondered what would happen if your kidneys can't secrete protein? Well, you'd be suffering from a rare disease commonly known as nephrotic syndrome. Nephrotic syndrome affects around 200,000 people in the United States yearly. Because it's so rare, not much is known medically about how to prevent it. If you're suffering from nephrotic syndrome, you'll have two main signs and symptoms. You'll have edema or the swelling of your eyes and legs, and you'll also be having blood clots. Unfortunately, having nephrotic syndrome also increases your risk of having health problems. Nephrotic syndrome is caused by an underlying condition. The underlying condition may be anywhere from diabetes to health problem to the underlying condition may be anything from diabetes to cardiovascular problems. Because of this, if you have any health problems, you're at risk for nephrotic syndrome. Don't worry though, because nephrotic syndrome is very rare, you probably won't get it. Now that we've talked about one of the most rare disorders of the urinary system, let's talk about the most common. The most common urinary disorder is a urinary tract infection, or UTI. UTI sent 8 million people in the US to the doctor last year. UTIs are most commonly caused by gram-negative bacteria, such as E. coli. So there are two main types of UTIs. There's urethritis and cystitis. Urethritis is an infection that is in the urethra, and the cystitis is an infection in the bladder. So when you have a UTI, you will usually have chills, pain, you'd have a burning sensation when peeing, and sometimes you can have, if you have a UTI, you can be prescribed antibiotics to treat it. So now if you're a woman like me, you are more prone to getting a UTI than men. And this is due to our female
Renal
anatomy.
cell carcinoma is not an infection or a syndrome. It is a mutation that occurs on a cellular level. On the cellular level, cells go through a process called mitosis, in which the cells divide. During this process is called anaphase, and it's after the cells divide and they're spreading apart. It's more like a resting stage. When cancerous cells go through this process, they go through this anaphase stage, so the abnormal cells divide and multiply much faster than regular cells. All cancer comes in 4 stages. For RCC, renal cell carcinoma, the first stage, the malignant tumor is under 7 centimeters millimeters in diameter and is still within the confines of the kidney. In stage 2, it is greater than 7 centimeters but still in the kidney. In stage 3, the tumor starts to spread outside the kidney, and in stage 4, the tumor has spread to other organs in the body.
Chronic kidney disease is a condition that leads to damage of the kidneys. It also loses the function and ability to filter the liquid waste. If they continue to get worse, and the waste levels will rise and reach its limit, and this will cause the blood to become toxic. If diagnosed, you must change your lifestyle completely to stay healthy as possible. This disease can lead to death. So if you don't take care of yourself right,
I'll just try the sentence over.
Yep. Okay. This disease can lead to death if you don't take care of yourself. You must start to make changes like have a healthy diet, drink lots of water, and exercise on a regular basis. If you start to feel these following symptoms, you might want to see your doctor as soon as possible. For example, fatigue, loss of concentration, low appetite, difficulty resting, muscle pain, swollen torsos, itchy skin, and if you have to pee or urinate more frequently than usual. So, yeah. Rise and reach its limit, and this will cause the blood to become toxic. If diagnosed, you must change your lifestyle completely to stay healthy as possible. This disease can lead to death. So, if you don't take care of yourself right,
I'll just try the sentence over.
Yep. Okay.
The urinary system isn't as popular as many other body systems. It's still very important in maintaining homeostasis of the body. In fact, if your urinary system wasn't working properly, if it just wasn't working at all. In fact, if your urinary system wasn't working in your body, you'd die within 2 weeks. Kidneys are a large contributor to this. They filter out large amounts of blood, and they take away waste, which makes sure that you have good blood circulation. You wouldn't be able to live without them. The urinary system as a whole is important in ensuring a clean, healthy body.
Woo! Yeah,